Hello, so today I'm going to be talking about different treatment modalities of snoring and obstructive sleep apnea. So most doctors provide positive airway pressure therapy like CPAP machines as a solution for their snoring and OSA. However, 50% of the patients are not able to tolerate these machines. So there are other options that we can provide to our patients like the oral appliance therapy, also called as Mandibular Advancement Devices. These devices are provided by specially trained dentists. These are customized, removable, easy to use and manage devices. The other treatment modality could be surgical intervention. Depending on the kind of surgery that is required, T's or maxillofacial surgeons are included as part of the team. There are also some adjunctive or supportive therapies that sleep specialists could advise their patients, like weight loss, lifestyle changes, breath retraining, positional therapy, and myofunctional therapy, which is like physiotherapy for orofacial muscles. Therefore, it is important to look for a good, well-trained sleep specialist who can provide a complete, holistic, personalized treatment plan for you.